Hello everybody, welcome to SHEENA'S Guides. Today I have got Kesia Biji, who is going to explain in detail about how to get into nursing. What qualities do you need to get into nursing? Before you find out that you want to become a nurse, what all you should think about. So thank you very much, Kesia, for doing this video for me.
Hello, my name is Kesia Biji. I'm an adult nurse currently in her second year. In this video, I'll be talking about personal statements, commonly asked interview questions, and tips for students who are thinking about doing nursing in the future. Firstly, there are 4 types of nursing degrees you can apply for. You have adult nursing, pediatric nursing, mental health nursing, and learning disability nursing. Whatever degree you're applying for, you will need to submit a personal statement. What you put into the personal statement will change depending on the course you're applying for and the unis you're applying for. Some unis require you to have 1 science subjects, while other unis do not require this and just want you to get the grades they need for the subjects you have chosen. When you are doing your personal statements, you need to think about care experience, because some, if not all, of the universities will require their nursing students to do care experience. In my personal statement, I talked about my experience within the hospital, care home and charity shops. When talking about these experiences, you need to talk about what you saw, what you did, and what skills were required within the experience and how these skills will help you to be a better nurse in the future. Once you have submitted your personal statement, if you are successful, you will be asked to come for an interview. These interviews can take place through Skype or other social media platforms or face-to-face. Commonly asked interview questions are scenario questions. So this can be where they give you a scenario and ask you what you would do in that scenario, or ask you to tell them a scenario where you can show that you have shown care or compassion. Other questions are questions like where they ask you what are the 6 C's. The 6 C's are the basics of nursing, so make sure you know what the 6 C's are, what they stand for, and the meaning of the 6 C's. Finally, they like to ask questions about current events that impact nurses, so make sure you look into the news and see important events in nursing, because interviewers tend to know this and they would like you to know it as well. Finally, tips for students who are thinking about doing nursing in the future. First, nursing is a professional course, which means compared to other degrees, you will not have a lot of time off. So make sure you do know this when applying for nursing. Secondly, nursing is 50% theory and 50% placement, which means sometimes when you are on placement, you might need to hand in some assignments, which means you need to be responsible as well as somewhat organised. Finally, getting into nursing is pretty easy compared to other courses like medicine. However, finishing the course is hard because of the structure of the course and the type of person you must be. This means when applying for the course, make sure you're doing it for the right reasons. Make sure you're doing it because you are a compassionate person, you want to care for the patients. If you're not doing it for this, you will finish the course and you would have wasted 3 years of your life and you will not want to do a job within the degree you have chosen. So, thank you so much. My name is Kesia Biji.
If you want to know more about nursing or anything related to nursing, you are all happy to contact me on the email provided or post your comments. If you have not subscribed my channel, please subscribe my channel and like, and please post in your valuable comments. Thank you very much for watching my YouTube videos. Hello everybody, welcome to Nursing Talk Channels. Thank you for all the support and guidance and feedback you have given to me. Coming to UK was one of the biggest achievements in my life. It helped me with my career progression, financial stability, and also education of my kids. Why don't we help our family and friends who are qualified as nurses abroad to come to UK? What steps do they have to undergo? Today, I have got Uni, who is from Vasco Medicus, who is going to explain in detail how a registered nurse, a nurse who is registered abroad, can come to UK, what all steps SHEENA'S requires. Thank you very much, Unni, for all the help.
Hello everyone, my name is Unni. I am the Operational Director for Vasco Medics International in Manchester, UK. Sheena Biji and her Nursing Talk channel kindly invited us to share with you how to become a registered nurse in the UK. Those who wish to work as a registered nurse in the UK, I'm sure those people are already registered nurses in their prospective countries and they have some experience or without experience. That's not a problem. We would like to share with you the step-by-step process how you can become a registered nurse as fast as possible. There are 4 steps mainly we could actually identify. So you need to be a registered nurse in your own country or a country where you are registered. Secondly, you need to comply with the NMC and the Home Office. That means the Immigration Office for the UK. So the NMC means the Nursing and Midwifery Council, similar like the nursing councils you are registered in your prospective countries. And there are few requirements set by the NMC that you need a certain level of qualifications with the nursing registration in your prospective country, as well as English language requirements set by the NMC. We will go through with that one in detail in step-by-step process. Also, you need to complete the NMC registration process. Along with, you need to complete an exam called CBT, and we'll go through with that one in detail in a bit. And also, once you reached in the UK, you need to complete an exam called OSCE, Objective Structured Clinical Examination. So we will, in this video, we would like to share these steps in detail, as well as how we as a company can help you to become a registered nurse in the UK as well. So the first thing, you need to be a registered nurse in your country or the country where you are registered. So those qualifications normally, general nursing and midwifery, 3.5 years experience, 3.5 years course, or 4 years of BSc nursing. Once you have completed that, with or without experience, definitely you can register with the NMC UK nowadays. NMC is not strict on registering with the Nursing Council with experience. So you can register without experience as well, provided you meet the other regulatory requirements such as English language requirements and the CBT, OSCE, etc. So the English language requirements, if you do take into consideration, you have got 2 exams nowadays you can write to be eligible to become a registered, to fulfill the requirements for the NMC, which are IELTS, International English Language Testing System, and OET, Occupational English Test. So for the IELTS, in academic version, you need to have at least 6.5 for the writing, and rest of the modules you need to have 7, overall 7 band. For the OET, you need to have C plus for writing and B for remaining modules. Once you have secured the score, you can actually start the process to register with the NMC, which is the Nursing Midwifery Council UK. Once you have completed the first stage, they will send you a notification or an approval to write the test called CBT, which is a computer-based test. Once you have successfully completed that test, you can actually continue with the remaining process and attend your interviews. Attend your interviews is not a matter. We can actually arrange that anytime once you completed your English language test. Depends on the requirements set by the employer, which are a few different categories. We'll explain that in detail. So once you have completed the CBT stage, you can go ahead with the interview, and if you have already completed the interview in the previous stages, any of the previous stages mentioned earlier, so you can actually submit all your required documents set by the employer to the employer to process their COS, Certificate of Sponsorship. So Certificate of Sponsorship used to call the work permit a long time before. Once you have in possession of the Certificate of Sponsorship, you can actually submit those documents with your nearest VFS, Visa Facilitating Service Center, or the British Consulate or the British High Commission in your country. So once you have submitted, normally within 15 working days, you will get your visa through. Once you reach in the UK, you will get trained in practically how to work as a registered nurse in the UK in a supernumerary position, as well as you will get theory knowledge to pass your OSCE, which is Objective Structured Clinical Examination. Once you have completed your OSCE, you will get the registration from the Nursing and Midwifery Council, which is called PIN number in the UK. So you can work as a registered nurse from there. So we as a company, we can assist you in any of these above 4 stages. Once you are, provided you are a registered nurse in your country or prospective countries, wherever you are, we can actually assist you to become fully qualified with your English language requirements set by the NMC, that is IELTS or OET. If you, wherever you are, that's not a problem. We have got a dedicated team of tutors who can actually assist you online. And for the next stage NMC registrations, we can assist you for that as well. Also, we can assist you to complete the requirements set by the NMC, which is the CBT next. We can get you trained for that and get past that one. And also, we will assist you in each and every stages of your process until you reach in the UK and further. So we will assist you to train and support you with the OSCE training. We have got our own team in the UK, which includes the university professors from different universities. We can assist you with that one to successfully complete your OSCE if in case you need an extra support rather than your employer provides. And also we are supporting a few of our employers who we recruit to get you trained with your OSCE practical as well as the theory part of the same. And the one thing we can actually say to you that, provided you are dedicated and honest to yourself at least, then definitely it's not a big thing. Definitely you could become a registered nurse in a matter of 6 to 8 months. It's from the candidate's experience we have actually trained and placed in the UK successfully. So I hope I have covered everything and you got a clear idea about how to become a registered nurse in the UK. We will come back to you with a different topic next time. So thanks again to Sheena, Biji and Nursing Talk channel. Bye-bye for now. Thank you. Bye.
I also would like to tell you that you don't have to pay a single penny to any of the agencies who are planning to bring nurses to UK, because the trust has already paid money to them. If you want to get in touch with Uni or the Vasco Medicals, their details will be put down in the description box. Or if you want to know more about from me, you can directly get in contact with me. Thank you very much. Good morning to all my dear friends. Welcome to my new YouTube channel called Nursing Talks. I'm Sheena Phillips. I work as an advanced nurse practitioner and advanced practice nurse in Village Surgery, Silksworth. The main aim of this channel is to discuss about nursing life, about career development for our nurses, and also career tips and choices for our kids, and also health promotion. Today in this video, Dr. Ajimol Pradeep, liver transplant coordinator, has come forward to give 5 tips how she progressed in her career. Thank you very much for watching this video. Hope you liked it. Please subscribe, like and share my video, and also leave a valuable feedback, so that will help me to create new videos as per your request. Thank you.
Greetings to one and all. My name is Ajimol Pradeep, currently working as liver transplant coordinator at King's College Hospital in London. Thank you, Sheena, for giving me this opportunity in nursing. Soon after completing my course and internship, I came to UK in 2000, joined Manchester Royal Infirmary Hospital renal unit as an adaptation nurse or a band 4 nurse. I was blessed to have a good supportive mentor and the management team in my unit. Successfully completed my adaptation period and joined the same team as a staff nurse or a band 5 nurse. As part of the academic and career progression, the unit offered me a fully funded degree pathway, which I enrolled in. Soon after completing my degree pathway, there was an opportunity to join as a band 6 or a sister post in a transplant ward. That was my eye-opening experience because I've seen the patients' life transforming after the transplant. So I was curious to learn more about it. I was very keen to know the post-transplant care, and at the same time I was fortunate enough to get an opportunity to do my master's in nursing, again fully funded by the trust. As part of my master's program and being a sister on the ward, there was another opportunity to grow in the career as a specialist nurse or a renal transplant coordinator role. So I joined that position, and as part of the role, it was important for me to understand the job more in detail and to learn about each of my patients who are on the transplant waiting list. One of my responsibilities was to attend the patient and with their one-to-one clinic. So during one of my clinic appointment, the patient asked me, who was from Asian background, openly asking me, Aji, is it because I'm not white, they are not giving me a transplant opportunity because I've been waiting for more than 3 years. He had his own justification for his question. I thought that was a bit challenging, but of course I didn't know too much into details. Even though I know 100% NHS won't discriminate the patients because of their ethnicity, I felt that it is important for me to look into it in more details. So I took that challenge positively, and I discussed it with the authorities, and felt that this is a God-given opportunity for me to explore this further and to educate my community on the lack of awareness and the need of increasing organ donation among our South Asian community. So also I took this further to do a PhD study as well. Continued with my volunteering work of raising awareness in the community. So the first lesson I've learned is the importance of continue with learning. As nurses, there is no end to what we need to learn. So always remember to wear your learning hat on and continue with your learning. The second lesson I learned is never to give up an opportunity. It could be a career progression or academic progression. If you have been offered a position or an opportunity to learn something new, never say, my family or personal circumstances is not right and I can't do it now. Remember, that opportunity will never come back to you. Sometimes we need to come out of our comfort zone to take the challenges and to see whether we can do it or not. Without taking the challenge, we will not know whether we will succeed or not. So it's very important not to give up an opportunity. Third lesson I've learned is always find a mentor when you start a new job. Remember, we might have got a lot of experience from our past, but the place you are in is a new area, new surrounding. So your strength may be someone else's weakness, but your weakness may be someone else's strength. So we need to ask questions. Never be hesitant if you're not sure about to ask questions and clarify accordingly. Never assume things and do accordingly, because remember, we are handling lives. So if you assume something and do, and if that comes back as wrong, you don't have a backup to stand. So always Remember to ask questions and clarify before you do things. The fourth lesson I've learned is the importance of ownership of your actions. Be honest. We as human beings are more prone to make mistakes. That doesn't mean that you are a bad person or you have got a bad career. No. As long as you acknowledge your mistakes and you own up the mistakes, you're fine. You can move on with your career. But if you start hiding your mistakes and telling lies about your mistakes, then it will take you to the wrong end. The fifth and the most important lesson I have learned is being humble, at the same time being confident. On the other hand, please don't be overconfident, because that will cause more problems. We've been called to do a noble profession, and I personally feel I'm blessed to be in this profession. So I'm wishing you all the very best, and stay positive, and you will reach heights. This is a very noble profession what we are all enrolled in. So stay positive, stay calm, and do whatever you can to help your fellow human. All the very best. And on the other hand, I want to reiterate that if I can do, I strongly believe any of you who are listening to me can do all these achievements without any problems. So wishing you all the very best, and stay safe and take care.
Thank you very much for watching my Nursing Talk channel. Please subscribe, like and share, and also click on the bell button. Thank you very much. Good morning, everyone. Welcome to Nursing Talk channel. Last week, we heard from Dr. Ajimot Pradeep how she progressed in her career and what are the 5 main important points. To keep in a nutshell, the 3 points what I would advise to people who are thinking about progressing in career is to have a dream, have your learning hat on. Third, most important, is to come out of your comfort zone. Today, I have got Bindu Thomas, who works as a nurse practitioner in neurosurgery department, who has come forward to give us a few tips how she progressed in her career. Thank you very much, Bindu.
Hello everyone, my name is Bindu Thomas. I'm currently working as a senior nurse practitioner in neurosurgery in one of the regional neurosurgical centers in United Kingdom. I was qualified as a staff nurse in 1994 from St. Luke's School of Nursing in India. Came over to United Kingdom in 2000. Prior to that, I worked in North India and in Middle East for a few years. If I want to say about my career progression, the most important thing is, like, I've worked in different areas, different departments at different levels of nursing throughout my career. And one important thing I did was never stopped challenging myself. I kept on challenging myself even now up until today, and I am willing to do that in my future as well. So thanks to my friend Sheena, who asked me to do this video just to help people in assisting who want to develop in their career. I have 5 points, and the 5 points I want to advise people is, the first one is having a dream. You need to have a vision in your life. Follow that dream until you reach that. The second one is believing in yourself. Trust in yourself, because if you don't trust in yourself, nobody else will trust in you. The third one is never stop learning. Your age, your situations, time, those are all factors in life, but everything will go along with it if you just continue to have the attitude to learn new skills, acquire new knowledge every day, and that will help you in your progression. Fourth thing is strengthening your interpersonal relationship with your team members, your colleagues, your seniors, your juniors is most important. Never be shy to ask for help when you need it, Also, you need to show people your strength and abilities. If you don't show them, if you stay quiet, nobody will know what your strengths are. So try and excel in what you're doing. Fifth one is just taking some ownership for your developments in your career, coming out of your comfort zone. Sometimes it's difficult for people, but that's where the challenge comes. You need to keep on trying. You may not be successful every time, but if you keep on trying, you will reach it. You need to just have that motivation, the enthusiasm, and that I can do attitude. That is the most important thing. So if I want to put everything together into 3 things, I would say your positive attitude, which matters mainly. Second most important thing is your effort you put into anything, which is fundamental in any career, whether it's in your life, your career, your studies, it's most important, and the progression. So you need to give your ideas to others so they know your skills and knowledge, and you automatically progress into where you need to be, and you will reach your goal at the end of the day. So until you reach the goal, never stop. Keep on trying. Best of luck to everyone. Thank you.
Thank you everyone for watching my YouTube channel. Please like, subscribe and share my Nursing Talk channel. Thank you very much. Hello everybody, welcome to Nursing Talk channel. Hope you're all doing well. Today I would like to discuss about what is, apart from the bedside nursing, what other nursing opportunities do you have? There are 5 nursing opportunities which I would like to discuss in my Nursing Talk channel. 1, about nursing as a legal consultant. 2nd, nursing corporate nursing, nursing informatics. 3rd is forensic nursing. 5, travel nursing or cruise ship nursing. So today I have Ashita Xavier, who is one of our students who came here, qualified and became as a student nurse, and now has gone on doing at the moment working as a corporate nursing. So let's hear from her what is corporate nursing is. Thank you very much, Ashita, for all the help you have given me.
Greetings everyone. My name is Ashita Xavier and I currently work at Leeds Teaching Hospitals Trust as a Band 6 sister at corporate nursing. The team name is Professional Practice Standards and Safety Team. I would like to thank Sheen Auntie for giving me an opportunity to share my nursing career journey with you all. I really hope that you will find Nursing Talks very beneficial in succeeding your aspirations. To talk to you a bit about my nursing career, I completed my BSc Honours degree at Leeds Beckett University in 2013 with a level 5 in Leadership and Management certificate from Chartered Management Institute. I started my first job as Band 5 staff nurse at Cardiac Intensive Care Unit through the nursing cohort interviews. In UK, nursing cohort interviews are conducted to recruit the newly qualified nurses and provide them with the opportunity to make 3 choices of clinical areas or specialities that they would like to start their career in. I worked in cardiac ICU for 3 years, and during this period, I completed all the competency packs and completed my SLIP course, including sign-off mentorship in 2016. At this point, I felt I wanted to explore another spectrum of nursing and step up to the next level. I decided to apply for a Band 6 in Informatics and MMPS, so that stands for Medicines Management and Pharmacy Services, as a project nurse to implement electronic medication prescription and administration system to replace the traditional paper prescription charts. In this role, I learned change management methodologies and, as a Band 6, how to influence change and overcome barriers to change. I had to be the role model for medicines management procedures, which I felt as a great responsibility, as my team would look up to me as a senior, and during this implementation phase, staff were monitored on their medicines administration practices, and any non-compliance to policy were escalated and training were then provided. During this job, I realized how much I love teaching and being that person who evolves change and maintaining standards. In 2017, I applied for a Band 6 at corporate nursing, which is what I'm currently doing. I wanted to explore corporate nursing as it is not widely known to the public. Corporate nursing teams are directly under the management of the Trust Chief Nurse and Operational Nursing Directors. Our team focuses on the monitoring of professional standards and patient safety of the Trust. We are responsible for the metrics audit framework and set standards for the nursing teams. The audits moved from monthly to weekly to ensure that standards are continued to be met during the pandemic. Clinical areas performing below 80% at the end of the month are classed as red. We use the traffic light system to escalate, and once a ward becomes red, they trigger an assurance visit from our team. During the assurance visit, we audit the whole ward and pick up themes around the general ward environment, leadership and management issues, documentation standards, patient and staff feedback are obtained to support our findings. An action plan is then created on an individual basis, identifying the support plan to aid improvement. The support plan will include leadership support, education, team building, and boosting staff morale through empowerment. The metrics audit will continue to be monitored to measure improvement in compliance. In addition to the metrics audit, we also get the opportunity to be involved in the quarterly nursing audit process, quality improvement collaboratives, policy development and review. My current role has molded me to be a better nurse and be more confident in the way I hold myself. I've been able to build relations with both internal senior leaders and external organisations such as the police in the missing patients policy development and review. I'm now enrolled on to the Lean for Leaders Leadership and Management course in order to enable me to step up to a Band 7. I have an 18-month-old daughter, but being a wife and mother never stopped me from aiming higher and achieve my goals. In the last 7 years of my nursing career journey, I have always looked out for opportunities which will equip me in my career development. The early years of nursing is all about exploring the diversity within nursing. In UK, we are quite privileged that we have a lot of routes we can explore, such as clinical educators, advanced nurse practitioners, and in the community we have district nursing, intermediate care, workforce and education within the trust, human resources, operational management through corporate nursing, medicines management, pharmacy services, etc. The list just goes on. Based on my personal career journey in nursing, the 4 tips I would like to share with you all are, firstly, to have a clear aim or goal so that you know where you want to be, and it's about how you are going to get there. 2, in order for you to achieve your goals, you need to challenge yourself. Fight through all the challenges. Make sure nothing stops you from developing. 3rd, express your interest
for
in career
watching my
development to your
Nursing Talk
managers.
channel.
And a good
Please
way of doing
like,
that is
subscribe
express it through
and share,
appraisal.
and also
Then it becomes
leave
written
your
down,
valuable
it
feedback.
becomes an objective, and it makes it formal, and they will have to support you once it's on your appraisal. And 4th is sign up to personal development courses. Don't hesitate. Take every opportunity that comes through. Sometimes it's funded, sometimes it's in-house training, but it's about giving yourself an opportunity. Thank you all for watching my video on Nursey Talks, and I strongly recommend you all to tune into the new videos that are due to be uploaded. I hope you all find this very useful and work hard to get to where you want to be in life. Please like, share and subscribe this channel. Thank you.
Hello everybody, welcome to SHEENA'S Guides. Hope everybody is doing well. So thank you very much for all the feedback you have given me. So as per the feedback, there are 3 topics which has been asked for me. One is regarding nursing. Ask me about my job role and also what I do in my job role, plus how can we get into the GP practice. That was the first question. The next one was about OSPAP. So how can we get into OSPAP, get more details about OSPAP, and also to get a student from OSPAP to tell more about it. And the third one was about how to get into what are the different routes to get into the teaching. So one by one I'll be doing in the next few weeks. So today I'm going to talk about my job role and how to get into the GP practice. Telling about myself, I work, as you all know, I work in the GP practice as an advanced nurse practitioner as well as an advanced practice nurse. So before I come into this GP practice, I was working in the secondary care. Started my career in 2004 in one of the NHS trust as a staff nurse. Came with a diploma into UK. Did my degree in 2005 at Sunderland University. Finished that in 2 years. After I finished my degree, there was no change in my career. Still continued to work in as a staff nurse. So during my appraisal, I had told my ward manager that I would like to progress in my career, and I was very fascinated with the night practitioners in the hospital. So I wanted to do something similar to that. So then she said probably it would be better off to do the clinical skill. So I did a level 6 clinical skill. When I went on to do my level 6 clinical skill, I really liked it, and that was my turning point. And then from there, I went on to do my masters at Teesside University. When I went to the masters, there were very different options to pick up, so I really didn't know what to pick up. So luckily enough, there was a tutor who helped me, guided me, because she asked me what am I doing this course for. She gave me different options that you could work in the secondary care as an advanced nurse practitioner, or if you wanted to further after some year, or if you wanted to go into the GP surgery, it is best to pick up advanced clinical practice, where you can pick up modules of your nurse practitioner as well as the modules from the GP land. So I felt that was really good. So I picked up advanced clinical practice, where your core modules were evidence-based practice, research proposal, that is designing research methods, and dissertation. Whereas the other modules we could pick up. So I picked up advanced clinical skills, advanced pathophysiology, prescribing, as well as long-term conditions. So that was my turning point. And when I was doing my masters, that was everybody noticed that, everybody was saying about. And then when a first nurse practitioner job came in, I applied for it, and luckily I got it. As I said before, I started at the staff nurse in the admission unit. So from there I went on to advanced nurse practitioner in the ambulatory care, which is now called a same-day emergency care unit. So when I was doing there, used to get different GP referrals from the GP referrals. So that really, and I was knowing more about GP practices and what the GP nurse practitioner does and what the practice nurses does over there. So that too role, I liked it, and I went and looked more into it and found out that what all modules I needed and what I have to do. So the long-term condition which I did at my master's level, that helped me to further progress it. So I picked up modules at my own time and did my diabetic module, respiratory module, women's health, which included contraception and HRT or menopausal management, vaccinations that included childhood vaccination and travel immunization, wound health. So that included compression bandages and extras, etc. So these were done at my own time, and I was doing the shadowing at the GP practice. So I sent my CV to went and spoke to different practice managers, and one of the practice manager I was lucky enough to get the help from them. So I used to shadow at my own time when I was doing the modules. So along with that, I also did my cervical smear screening also, smear also. Once I got the money training and the thing, I could put it on my CV, and then I went through the agency to do a couple of shifts through as a practice nurse. And one of the GP practice where I went was the GP practice which gave me a job now. So I started as a practice nurse as well as a nurse practitioner. So when the job vacancy came there, they asked me whether would you like to come as a band-aid over there. So that's how I have got a dual job as a band-aid in the GP practice. So what is GP practice nursing? What do they do? So in the GP practice, the nurse who does the nursing job is called as the practice nurse. So if I compare from the hospital and the GP practice nurse, the responsibility is quite a bit, because in the hospital when you are a nursing, you are carrying out the orders what the doctors give it to you, and you always have somebody there you always have doctors and everybody there to guide you, or if you need any help, they are there. Whereas in the GP practice, most of the time, even though you have a GP, most of the time it is an autonomous role, because you are, and plus if you are a prescriber on the top of it, you're doing everything of your own hand. So what do you do? Round from all the annual reviews of the long-term conditions like diabetes, heart disease, hypertension, COPD, asthma. So even though the rheumatology patients are being done by the secondary care, mental health reviews are being done by the secondary care, but still it is our practice nurse job to continue with that, follow it up. So all the annual reviews, even if you are a prescriber, even the medication review is also done by you. The second thing comes the women's health. That comes with the pill reviews or initiation of the pills, pill reviews, women's health, and many women's problems. And then also the smear. All this comes under the practice nursing. Then comes the immunizations, the child and the travel immunizations. Wound help. You have wound hubs around your area, but still most of the practice nurses will be trained to do wound dressings, compression stockings, checking the Doppler. So they all will be good in that. The main things are the flu vaccinations. All comes into the practice nursing under the practice nurse role. So they also do a couple of many audits, and also the infection control policies. And when the CQC comes for inspection, everything has to be checked and everything has to be updated by the practice nurses. So the role is quite a big one, and I never knew that the job was that big when I first started, but it's a really good challenging job. And apart from that, what do you do as an advanced nurse practitioner? So when you're in a GP surgery, you're advanced nurse practitioner, you see all the cases. Apart from the DNR form has to be signed by a GP, and a sick note has to be signed by a GP. Apart from that, everything else can be done by a nurse practitioner. In my coming videos, I would let you know what is the difference between an advanced nurse practitioner and a physician associate. What does physician associate do also? So that is also something people can look into. So if you are new to the practice, new to the GP land, so you can do the way I have done, pick up the modules what you like and then doing shadowing, or the second option is career practice nursing job. So where the area where you are, find out whether there is an opportunity called career start practice nurse. So what they would do is that they would give you a job, they would give you a band 5 salary, and also would give you training for becoming a practice nurse. So at the end of the 2 years, it's normally run for 2 years. At the end of the 2 years, you will finish with all the modules of the practice nursing, and also you can apply after that for a job. So normally you get a job straight away. So that's called Career Start Practice Nurse. In Sunderland, I think 2 years ago they used to do that course. But I think now it's stopped. But Durham, I think Durham is doing it. So you can inquire with the university, or you can inquire with the CCG to find out if there is a Career Start Nurse, Practice Nurse job there. And the second option is picking wherever, if for example, if you're working in the secondary care, you can pick up some of the courses are HNE funded, so you can pick up the modules what is being, and you can get funding. So you can pick up modules like respiratory modules, diabetic modules. If you're working in the diabetic wards, or if you're working in a respiratory ward, you can pick up any long-term modules, and so then you don't have to pay for it, and then you can do shadowing, as I did it in the other practice, and then you can pay for the extra modules what you have. So that way is the another option. Or the other option is, if the GP surgery, if you know any GP surgeries, or go and speak to some practice manager, and probably they can take you in, and they can help you with the courses, because you're a staff nurse. They can help you with the funding with the courses and everything. So if you have some courses in your hand, and if they think that you have got valuable experience, and they can help you with the further courses. So these are the 3-4 options where it is possible to get you as a practice nurse. So when you become a practice nurse in the GP surgery, it is easy to become a nurse practitioner, because always in the GP surgery they help you with funding, because they help you with progressing further up. So once you become a practice nurse and you have some couple of experience in your belt, so then they'll help you going into applying for a nurse practice, helping you with your clinical skills, and helping you with masters and also helping you to do the prescribing. So it's slightly more easier to do it if you have already got a practice nurse job in the GP surgery. And I just have to tell one more thing before you get into the practice nursing job, because every GP surgery doesn't have to be NHS under the NHS scheme. They can be private GP. So always do a shadowing, see how they are before you take the job. And on the interview, ask them if they'll help you with the funding of the courses also. So these are a couple of things which you can look into when you're doing the practice nursing job. I really love practice nursing job because I do a lot of health promotions, down from women's health, diabetic health, respiratory health. So these all you can explain, and very simple terms, and you've got that time because you have got a nursing at the background. I think you are more into health promotion. Would like to tell you what my typical day is. So normally my typical day is, when I start normally a shift at 8 o'clock. So start with the morning triage, all the emergency patients who are on the triage on the same day. So I would normally do a telephone triage and then bring them face to face. Yes, now because of the COVID pandemic, the face-to-face appointments are quite limited, but I'm not that experienced as a GP who has got loads of experience, so I try to see most of them face-to-face if they don't have any COVID symptoms, and try so that most of them I try to see. So I do the telephone triage in the morning and then bring them back later in the roundabout later in the morning to for a face-to-face, and then do a complete examinations, and diagnosis is made, and then a medication prescription and a follow-up will be done with me afterwards if they needed it. So that's my morning section. My afternoon sections are mainly for the practice nursing job, so it's more of either an asthma clinic or any long-term clinic. On Thursdays would be a child immunization. So it varies. Then comes the women's health smears and contraceptions and everything. So that's how I have a very varied clinic most of the days. So that's why I love my being into the GP practice. The difference between the secondary care and the GP practice is that in the secondary care, because I was working in the acute admissions, it was more of acute things, but that gave me a confidence to see anything and everything. But in the GP surgery, you were seeing from chronic to acute to chronic, everything. If you ask me what are the 5 main points to progress in your career, so the first main point what I would say is that to have an aim in your life. Unless you have that aim to do something, you will not be able to take it. For example, even if it is like a small, taking a degree or doing a master's, that small aim, or doing a degree, I want to do my degree, and that small aim, I would say if you have it, you would be able to do it. And if you have that aim, when you have an appraisal, let the ward manager know about it. That's the second thing. And the third thing, main thing, what I would say is that if you're a person who are on night shift, please come out of that night shift. Be on your days. Even if you want to go on the rotation, that's fine. But people will see you, because I worked 10 years in the as a night shift nurse. And everybody knew I used to be coordinator and everything. Nothing came up. I used to apply for band 6 jobs when I was working the night. You never got that job. So because nobody recognizes what is your capabilities. And what is your leadership skills and everything. Nobody recognizes. Once you come onto the day shift, people will recognize you, people will know you. So that is one main thing what I'll tell you to everybody. Because yes, for our family, for our kids, we've been on the care, and there is a big difference from, even in the money, there is a big difference. That's why we normally stay on the nights. But I would strongly advise for anybody who wants to progress in the career, come on to the days. The next point is find out find out more about. For example, if you wanted to be a specialist nurses, or if you wanted to be in the GP practice, find out more about it. How can you go into that? Because there are different options available. For example, if you want to do masters, when I did the masters through HNE contract, I did my degree and masters at my own time. The degree was funded by me. The masters, when I went in the university to inquire about it, they said you have an HNE contract, you get free. So there are many things. So nowadays I think appraisal programs are going on for masters. So find out from the university as a NHS worker what is available for you. And when you are that is the next one. So, and also if you wanted to come into the GP practice, go and speak to your local GP practice managers and practice nurses when you go there as a patient. Find out more about them. How can you also come into that role? The second thing, the fourth thing is that if you want to progress in your career, always you have to do something. For example, small audits in your own. So when I was working as a staff nurse, I used to do small audit, simple as hand washing audit, infection control policies, small audits, and I used to present in front of in our clinical meetings and everything. So that was you could put that on your CV. I used to be a diabetic lead. So that small things makes you that you seen in front of others. So the other main thing is that that you should respect others and get the respect from and respect yourself. So what I mean to say is that when others are progressing, or when you're in the ward, listen to what others are saying as well as listen to yourself. So these makes a big change. Today, what I am today, that's all because of my God's grace because nothing would have been possible without him, and also my prayers and blessings from my family, because they have sacrificed a lot for me, and that's why today what I am here today for, what I'm here today. So I'm happy to give any feedback to anybody who wants any help to progress in their career. Thank you very much for watching my YouTube channel. If you liked, please click the subscribe button, like and share. Post your feedback to me. Thank you very much.